All right, guys, welcome to our new podcast, Poop Scoop Monday, where every week we drop those knowledge bombs for you guys so we can answer your questions about your gut health, and we do deep dive in topic as well. So if you're joining me for the first time, my name is Dr. Islam. Who am I? I am a board-certified gastroenterologist trained at the Mayo Clinic. I've seen thousands of patients in my 10 years, and every week I try to do a podcast where I answer your questions that you guys have asked me, and I do a deep dive on a particular topic as well. So if you're new to this channel, here's the kind of form of how it works. Initially, in the very beginning part, we'll do a deep dive on a particular topic, and we answer any questions you have about that particular topic as well. And towards the later half, I also go on my YouTube and my Instagram, my Facebook, and my social media streams, answer any questions you guys have as well. If you want to be a part of the show, join us every Monday around 7:30 p.m. on our live streams where we can answer your questions live. But also, let us know if you have a question for us. We can communicate to us and let us know what questions and topics you guys want us to listen to as well. All right. We have a great show today, but first, before we begin, you may have noticed I'm in a different area than I normally am for my videos. All right, so we had to make a little bit of a change. We're doing some changes in the house, changing up some carpet, and the area that I normally do my video from and my podcast from is a completely different area. So I had to rearrange everything over the weekend, and I had to put this into a new area. So let me know in the comments, or if you guys see this, obviously it's kind of hard if you're doing it on the podcast, but let me know what you guys think. Let me know what you guys think about the new area where we're at right now. And also let me know if you guys like where we're at as well. All right, we have a great show today. Tonight, we're going to be talking about bloating, everyone's favorite topic. Literally everyone who comes to see me in the office asks me about bloating. We'll do a deep dive on this. We'll discuss exactly what are some of the causes of bloating. We'll discuss the foods that can help out with bloating. We'll discuss my recommendation as a GI doctor to help get your bloating taken care of. And at the end, we'll discuss exactly when you should see a doctor about bloating, because bloating is so common. Is it something to worry about? And for some individuals, that may be the case as well. So let's begin. So what exactly causes bloating? There are millions, literally millions of reasons why people can cause bloating. So when I talk about bloating, I like to see if I can categorize it to make it easier in my mind to understand the true cause of bloating. So we want to talk about things that we eat, conditions that occur inside of our gut, and behaviors that we know that can cause bloating as well. So let's talk about the foods that we eat. We know that there are certain foods that are notorious for causing bloating. We know that dairy, especially if you're lactose intolerant, can cause bloating. But we also know that certain categories of foods are also known to cause bloating. These are called the high FODMAP foods. So FODMAPs are certain carbohydrates and sugars that are called fermentable oligosaccharides, monosaccharides, disaccharides, and polyols. And these are foods that are very commonly can be a trigger for bloating, for gas, and diarrhea. So these include foods that we think are healthy for us, things like Brussels sprouts, apples, broccoli, foods that we know that are good for us, but for some reason, they can cause us to have a lot of bloating. In fact, I have a lot of patients who come to see me and say, hey, Dr. Islam, I eat healthy, but I feel like I'm 9 months pregnant. And it's a very common condition. It's not that you're not eating healthy, but it's that the foods that you are eating that are healthy for you actually may be foods that are difficult for you to digest. These are called the high FODMAP foods. But we also mentioned some other triggers as well. Sometimes gluten for certain individuals can be something that can be difficult for them to digest. And yes, having gluten allergy is real. Now, this is the true condition. It's not something that's seen just on social media. But there are a lot of patients that actually do have problems with certain foods like gluten that can make their bloating a lot worse as well. And then lastly, we also know that sometimes things like artificial sweeteners, things that are found in gums, in artificial drinks, these can cause bloating as well. These are foods that we know that can commonly cause bloating. The next category are intrinsic conditions inside your body that can make bloating worse. One of the more common ones is a condition called either dyspepsia or IBS, irritable bowel syndrome. These are kind of the two sides of the same coin. Dyspepsia is pretty much IBS of the upper GI tract, whereas IBS is issues in the lower GI tract, but they're very common, can cause bloating. And the reason that's the case is that we know there's a lot of change in the gut microbiome. We also know that sometimes the motility of our gut can be altered. We can have a stressful gut, or we can have a hypersensitive gut. It's all within that spectrum of IBS. So if you suffer from a condition called irritable bowel syndrome or dyspepsia, we know that these individuals have a more likely chance to feel bloated and to be bloated than somebody who does not have IBS. And so if you have this condition, this may be the case. Another medical condition that you can have is called small intestinal bacterial overgrowth, or SIBO. Very common condition in which you have an abnormal growth of bad bacteria inside your gut, and that can cause a change in the gut microbiome. And that change can manifest as bloating, distension, diarrhea, another common cause for bloating. Sometimes you can have a problem with the motility of your gut. So patients who have Gastro Pris or delayed gastric emptying, food just sits in their stomach for a long time. And one of the symptoms from that can also be bloating as well. And sometimes bloating can be a symptom of another completely different condition like reflux. Did you know that bloating and burping actually is a manifestation of GERD and reflux? Yes, it commonly is. In fact, I had a patient see me today who was telling me, "Hey, Dr. Islam, I have a lot of bloating, belching, I'm burping a lot. What is going on?" And so what I recommended for this patient is to try a trial of an acid medication. And this is sometimes what we do for those individuals in which we think acid reflux could be a cause. Because if that's the case, then obviously putting you on a treatment regimen to get your reflux taken care of may actually help out with bloating. And then lastly, some of the behaviors that we do can cause bloating. So see, it's simple things, but actually do cause bloating. So if you eat too fast, if you're a sloppy eater, you're just always putting food in your mouth, this will cause bloating. And it's very common in our life, especially with how busy we are, to be bloated because we're eating so quickly, we don't have time to sit down to eat. If you happen to swallow a lot of air, it's actually called aerophagia, a real condition, and swallowing too much air can actually be a cause for bloating. If you chew gum, guess what? When you're chewing gum, you're swallowing air. So the physical act of chewing gum itself can make you feel bloated. Also, too, if you're not having regular bowel habits, if you're constipated, that can cause bloating as well. So not having a regular bowel habit can also cause a backflow of things that cause bloating. So in my mind, this is kind of how I categorize patients to determine the causes of their bloating. So once we kind of know the cause, then we can delve into the treatment options. So what do I recommend to help treat my bloating? So number one, let's go over the foods that we can use to typically treat bloating. Some of the foods can be things like yogurt, things like ginger, oats, fiber. These foods are naturally caught foods that have a lot of prebiotics, probiotics in them that actually can treat the bloating and get your bloating taken care of. They work really, really well. Another food we commonly use is celery. Celery is also a very common helpful treatment when it comes to bloating as well. Sometimes avoiding the trigger foods when it comes to bloating can help out. So avoiding those foods that we know that can cause bloating, that we know that can get bloating worse, can make things better as well. And sometimes trying some other lifestyle changes can help out with bloating. So when I have somebody come see me with bloating, what do I tell my patients? So number one, I try to find out the cause. So if I do a workup, so I tell my patients, number one, avoid all dairy. I don't care if you don't think you're lactose intolerant. I want you to eliminate all dairy products. So things like milk, cheese, ice cream, things that we enjoy. Absolutely, I want you to eliminate that because I want to get it off your plate. Number two, I tell my patients to avoid all artificial sweeteners. Get rid of it. You may be one of those in which you don't realize your body cannot tolerate those artificial sweeteners. Number three, I tell my patients to avoid chewing gum and hard candies because this will kill two birds with one stone. It will prevent you from drinking or swallowing a lot of air, but also it will prevent you from trying to digest the foods that may not be undigestible for your gut. Now, once we do kind of these initial things and we see how you do, then I can maybe do some more treatment to find out what's going on. So for example, if I think you're suffering from a motility problem, we may do motility testing to see how long it takes for food to leave your stomach. If you have small intestinal bacterial overgrowth or SIBO, I may test you for that as well. Or if I think it's reflux, I may put you on a reflux trial to see how you do. Let's say we do all that and you're still having bloating. Well, what do I recommend? So assuming we've got your constipation taken care of and assuming you've already done the lifestyle changes, including things like not eating quick, not having carbonated drinks, and things like that, then we'll try to delve into more treatment options that we recommend. So what I tell my patients, number one, try to incorporate exercise into your diet or into your lifestyle, because exercise will help out to move things along. The motility of actually moving things along with exercise actually can help out in multiple ways to allow gas to dissipate and get you feeling better as well. Number two, I stress once again, are you constipated? Because being constipated is one of the more common causes to feel bloated because you're not emptying everything out. Even if you think you're using the restroom all the time, and even if you go every single day, you can still be constipated. You need to have a good complete bowel movement, make sure everything is out, because even a little bit that stays in there will build up over time and get you to become constipated. Sometimes too, I also recommend for my patients to try herbal therapies to help out. So things like activated charcoal, sometimes a medication called ibuprofen, or even something like FD Guard actually works. Obviously, you don't want to do this without the help or the advice of a healthcare provider, but sometimes these are things that we can use to help out with this as well. And for some individuals, we actually may want to do even more dramatic things to find out what's going on with bloating, including things like maybe doing procedures, maybe getting CT scans, or we'll let other conditions that can be a manifestation of bloating as well. But bloating is one of those conditions which is very hard sometimes for us to treat because it can be so multifactorial. It can be due to so many different reasons, and there are literally hundreds of different ways you can treat this, but this is the way I kind of categorize this in my head for me to better understand how I can treat my patients who have bloating, but also have a good comprehensive understanding of some of the causes for that. And then lastly, another question, when should you see a doctor about bloating? Well, I tell my patients, if you're having symptoms, you're not feeling good, come see us. We'll try to find out what's going on. But there are certain warning signs that we want to make sure that we're not missing. So if you're losing weight, especially if it's unintentional weight, that is not normal. That's not a normal sign for bloating. You get that figured out. If you're having, or at least a tide, you're getting full quicker and you're getting fuller with less amount of food. This is a sign that something bad is going on. If you start to notice a lot of pain in your belly, this is something that's worrisome, then we need to find out exactly what's going on so we can get that taken care of for you as well. Start to notice black stools or bloody stools. That's not normal. That's not part of bloating. So make sure you can find out what is going on with that so we can get that taken care of for you as well. And then lastly, if it just bothers you, come see us where we can find out what is going on. In our practice, we deal with a lot of bloating patients. And we try to do kind of a systematic approach to find out why they're bloated and hopefully get a good plan to get that taken care of you. So that was my deep dive on bloating. Let me know in the comments down below or on the questions if you have any questions about bloating as well, and see what we can do to hopefully figure out what is going on as well. All right. So if you're joining for the first time, my name is Dr. Islam. Every Monday, I do my podcast where I answer questions you guys have asked me. Typically, I do a deep dive, but if you're watching, I also do a part of this as part of my live stream as well. So if you're on the live stream, let me know if you're watching this live or on the replay, and also where you guys are watching that as well. Ashley, it's good seeing you. Thank you for watching as well. Christina, thank you for watching as well. Ron, thank you for watching as well. So there's a great question that Christina asks. Reflecting on the Netflix show Hacking Your Gut, which I have not watched yet. It is on my watch list to see kind of how this show is. The question she asked me is, she saw somebody doing a poo transplant from her question. It seemed crazy. Am I wrong to be concerned about this trend? You are wrong. You are not wrong. I apologize, to be concerned about this trend. So let's talk about this. Fecal transplants or poop transplants. What is it? Do I recommend it? Does it work? Should you do this? Great topic. Let's talk about this. So fecal transplants actually is literally what it says. You put someone else's stool in your own body to see if we can change what is going on in there. Now, fecal transplants have been around for a long time. Millennium. Yes, back in the BC era, people were doing fecal transplants. And so what do we know now about what the indications are? So there's really one true indication for a fecal transplant. This is for a condition called C. diff. C. diff is a really intense bacterial infection of the colon that can cause tremendous amount of diarrhea. In fact, it can actually kill people. And one of the most effective ways to do this is to do what's called a fecal transplant, which literally we put in someone else's stool inside you to make sure we can change the gut microbiome to make it normal again. And it has over a 90% cure rate. It actually does work. Now, a couple things I have to stress. Number one, we always do this under the supervision of a doctor. And number two, we always make sure we do the donation in a very clean and in a way that is healthy for the patient who's getting the donated feces. Which brings back to the next part of this topic. What other reasons or other indications can we do a fecal transplant? So there's some studies that suggest that maybe in IBS, irritable bowel syndrome, that you can do a fecal transplant help out. There are some studies that suggest that even doing it in a condition called ulcerative colitis can help out. Let me stress this. We have no evidence that doing this is going to actually help out with those conditions. So don't do this and don't think that this is going to be the cure for your disease. And then most importantly, should you do this at home? Absolutely not. There are so many ways this can go wrong. I mean, come on, guys. How do you know if that stool is clean? How do you know there's no infection in that stool? How are you even going to put it in yourself? No way, no how. So if you're thinking about doing a fecal transplant, let me tell you, let me make it easy. Don't do it unless a doctor tells you to do it. Now, if the doctor tells you, okay, that may be an option, but don't try and do this on your own because it's not going to work. It's not going to be the thing that you want to do, and it certainly will make things worse for you as well. So I appreciate that. All right. Next question from Ron. Citrusol pills or powder for fiber, which is more effective? Great question. So Citrusol is one of the fiber supplements that you can take that I recommend to help out with your gut microbiome. And people ask me all the time, hey, what should I take? Which one is the best? Let me tell you, there's not a right answer. Here's what you need to know about fiber. Number one is that it has to have the word psyllium, P-S-Y-L-L-I-U-M, which Citrusol does. And so make sure it has psyllium. Now, the choice to choose fiber or a powder or a pill depends on you. Not a big deal. Pick one. Doesn't matter. Just make sure you get at least 25 grams of fiber per day. I do the powder myself because I add to my coffee. Not a big deal. Take it in the morning. I have others who take the pill. Doesn't matter. As long as you get the recommended fiber that you need to make sure you can get you the health conditions you need for your gut. So, Ron, I would say pick whichever you want. Not a big deal. Don't make it a big deal as well. All right. Next question. Hey, Dr. Islam. I have heard about a condition in which you can see what is actually going on in some of the areas in your small intestine. What is that condition? So that's a very common question. I'm glad you asked this question. There are a lot of conditions that can actually affect the small intestine that we don't actually see with the scopes. And there are things like Crohn's disease, celiac disease, or any autoimmune diseases can actually affect this, which is hard for us to know exactly what the reason is and what the cause is. And so sometimes you have to do different evaluations to see what it is, whether it's imaging tests, whether it's what's called a pill cam or a capsule or things like that, for us to do or to find out exactly what could be some of the causes going on in the small intestine. So we have a lot of fancy tools that are available for us to hopefully give you a better answer for what we can do to get things taken care of for you as well. Next question. Hey, Dr. Islam, I heard you talked about Gastro Pris. Give me a little bit more information on that. All right. It's a great topic. Its own video itself. So gastroparesis is what's called delayed gastric emptying. This means the food does not want to leave your stomach as quickly or as often as what you would like. So normally when you eat, it takes about 4 hours for all that food to leave your stomach. In 4 hours, you should have virtually no food anymore in your stomach. The issue with gastroparesis is that that food will stay in there longer and more often, and that can cause you to have a lot of symptoms, the most common symptom being nausea and vomiting, especially after you eat. Very common problem to have. And so there are a lot of different reasons why people can have gastroparesis. One of them is called diabetes. Diabetes can affect your stomach to cause delaying of your stomach, to cause food to stay in your stomach, to cause complications to occur. It's reason number one. Number two is idiopathic. Sometimes we don't know why people have gastroparesis. And another reason is post-surgical. Sometimes people have had a surgery And in that surgery, you can actually cut the vagus nerve by accident, and that over time can cause you to develop gastroparesis. So how do I know if you're a condition, or how do I know if you have gastroparesis? Well, we do two things to determine that. Number one, we want to do first an upper endoscopy or an EGD. The reason we want to do that is that we want to rule out an obstruction that could be causing the symptoms of delayed gastric emptying, so like an ulcer, possibly even a mass, or things like that. If that is normal, the next thing we do is what's called a gastric emptying study, which we actually have you eat some food. We just see how long does it take for food to leave your stomach. And if it's delayed, then we know you have gastroparesis, then we can focus on treatments, including medical treatment and sometimes lifestyle changes as well, which can really affect what is going on when it comes to gastroparesis as well. All right. Let me check here. I'm just checking some of the questions we have here. All right, perfect. All right. All right, guys, what do you guys think about my new studio? I had to kind of jerry-rig this. I'm hoping people will like it. Let's see how it turns out there. All right. Perfect. All right, I think we went through most of the questions here. All right, well, thank you guys for watching. If you like videos like this, if you want me to continue this, please let me know what you guys like, what topics you want me to talk about. If you want to learn more, if you want to get more, don't forget to subscribe to my channel, subscribe to my newsletter, where you can join over 7,000 people who have already signed up for our newsletter to get more information about what is going on in your health. And thank you for watching. Don't forget to smash that like button, like, share, and subscribe. Look forward to seeing you guys on next week's video and podcast.